So you and your team, you mentioned earlier, have worked with around 8,000 patients. 98% are deficient in iodine. Somebody who's generally healthy wants to start supplementing with iodine. You mentioned the dose before. I think it was 12.5 milligrams. Would you recommend they get tested, or can they just safely assume they're deficient and start with that dose?
The worst doctor is be your own doctor, including doctors. It's good to have an independent person working with you and testing and things like that. So I would suggest before taking iodine, get your levels checked and work with somebody who's iodine literate. There are holistic doctors out there. Conventional doctors aren't going to be iodine literate. It's not going to be the case. So would I recommend people just taking iodine? No, I would get your levels checked and then, work with people. Now the 12.5 milligrams was on my kids when they were 11 and 12 years old. Generally adults, I started around 25 milligrams. That's about the average dose that I have most adults on in my practice. Remember I said earlier, if they have glandular disease, more. If they have cancer of the glandular tissue, more. And, you see your patients back, you retest them, you see how they're doing. And, what's really cool with iodine is these things can be the good test because you can feel cysts and nodules in the thyroid go away when they go on iodine. Woman who has fibrocystic breast disease, lumps, it's like hard rubbery lumps of the breast tissue, they go away. I mean, I've got case history after case history after case history of women with fibrocystic breast disease, having normal breasts after 6 months or so of taking 25 to 50 milligrams of iodine. One of my famous patients, I still lecture with her slides, Marianne. She came in about year 10 of my practice. I learned about iodine, and she's about my age, so she was like 40s. And she comes in and she says her history was that she was getting a bilateral mastectomy in 2 weeks because of severe fibrocystic breast disease, which she's had her whole life. And her breasts were so sore, she couldn't wear a bra. She couldn't let anything touch up against them because she said they were just so painful. She was wearing like just tense stuff, throw over clothes. She wasn't obese. She was like normal size. She was thin, but she couldn't wear anything. Certainly couldn't wear anything tight, or even just clingy because she couldn't stand it. So I remember when I did a breast exam on her in that first visit. I mean, her breast felt like alien tissue. I don't even know what to say. I was palpating her breasts, and it was like the only thing I could liken it to was when I was a little bit younger. I used to take Taekwondo in my younger adult years, and it had a punching bag, and I had a punching bag at home, and the punching bag was this blue hard plastic thing, and heavy thing, and her tissue felt like that punching bag with bumps, just the same plastic, bumpy, miserable, not human tissue. So I told her at that visit that I'd like her to cancel her surgery and move it out 3 months. I said, if you're not any better in 2 months from doing this, I said, it's going to take 6 months to a year to get your tissue to reorganize back to normal. But I said, if you're not any better in 2 months and it's the same, then this might not help you. Now, she was going to the University of Michigan, the winningest college football team in the history of college football, fibrocystic breast disease clinic. And she was seeing the chairman of the department. And then what they did there was they told her to come off chocolate, come off coffee, a few dietary things. And in her case, it didn't make any difference. She just got worse and worse and worse. Finally, he threw up his hands and said, you need to get your breast taken off. So she had scheduled that surgery and then saw me. And so I did an iodine loading test. An iodine loading test is where you take 50 milligrams of iodine at time 0, collect 24 hours of urine, and you're looking to see how much iodine clears out of the body through the urine. So through Dr. Abraham, and I was involved in this, we found that when the body is iodine deficient, all the iodine receptors from head down to the toes are saturated with iodine. If you take 50 milligrams of iodine, about 5 milligrams of iodine will sort of be reutilized in the body. 45 milligrams will pee out. If you're really iodine deficient, you're going to hang on to much more than 5 milligrams of iodine. You'll hang on, I'm just throwing numbers out here, to let's say 25 milligrams of iodine, and you'll pee out 25 milligrams. So a normal loading test is 95% excretion. You hang on to 5% of that, which is 5 milligrams of that 50 milligram load. In her case, she peed out 25 milligrams. She held on to 25 milligrams. She was severely deficient. She had a 50% excretion rate. So I put her on 50 milligrams of iodine. As part of a holistic treatment regimen, I put her on magnesium and B vitamins and vitamin D and vitamin A, whatever I found on her blood work. And 2 weeks later, she calls me. And I asked her to call me in 2 weeks because that was her surgery date. She said, I'm feeling better. I said, how much better? 5% better. But she goes, it's noticeably better. Can't wear a bra, but there's less pain. So I see her back in a month. And now she's 20% better. And she says, we're on the right track here. And I just asked to do an exam on one breast just to see if there's any change. I feel her breast, it's starting to soften up. It's still alien feeling. It's still plastic feeling. It still doesn't feel like human tissue, but it's better. So I see her back a month later, and she says she's 30% better. She's occasionally can wear a very loose fitting bra. She's wearing, clothes that she wants to wear, a little tighter clothes. I mean, she's 40 years old. She's a nurse. She, not dressing provocatively or anything, just wearing like what women wear. Um, and she thanked me, and she was crying at the visit saying, I'm so glad I didn't have the surgery. And gradually over 6 months, and it took a year before her breast exam was totally normal. But at 6 months, I go to do a breast exam on her, and it's like human feeling again. Now, there's still some bumps in there, light bumps, but it's human feeling. She's wearing a bra. She can wear whatever she wants. She can now wear a swimsuit, first time in ages for her. And she goes back to the University of Michigan for her checkup. She starts so the breast surgeon. So when I saw her that exam, I told the story a little bit out of order because she had canceled the surgery. I saw her at 2 months. She was 40% better, something like that. And I said to her, it feels like you had breast transplants, because it feels human again. So she goes to the surgeon, the University of Michigan Fibrocystic Breast Disease Clinic, somewhere after I saw her, and doesn't tell him anything. At first, he just comes in, does the exam. He does the exam, and he says, feels like you had transplanted breasts here. What are you doing? So she starts telling him. And she said, first he was looking at her in the eye. Then as she mentioned the word iodine, started going on about, her changes and what we're doing. He started to look over her, and he didn't roll his eyes at her, but he was clearly not paying attention. He let her finish. And then he said, okay, I'll see you in 6 months. And didn't ask anything, didn't seem to care about it. And she never went back again. So I've been treating her now for, I don't know, 15, 20 years, something like that. And she calls me up somewhere, maybe 10 years into taking iodine. Maybe it wasn't 10 years. I can't remember. It's in my slides with her. But she was 100% feeling good, wearing normal clothes and exercising and living life and still having her breasts. She calls me up and says, it's coming back. What do you mean it's coming back? My breasts are starting to hurt and they're getting lumpy again. I'm like, that's really unusual, Marianne. I said, are you still taking the iodine? She long pause. She says, oh my God, I forgot to order it. I ran out about 6 weeks ago, I think. And I've been off it for at least a month. And I said, you need to get back on it. So she got back on it. It went away. So this is my randomized, blinded, I guess it's not a placebo because she didn't take anything, but a randomized blinded trial because she didn't know it was a double blinded trial because I didn't know she wasn't taking iodine. She didn't know she wasn't taking iodine, and her symptoms started to come back, and it went right away as soon as she went back on iodine. So that story in various forms repeats itself over and over and over in our practice.
That's an incredible story. Wow. So adult dose starts at 12.5 milligrams.
25 generally.
Okay, 25.
Kids have 12.5.
Okay, I want to come back to kids, but let's stick with this for right now. You're talking about Lugol's iodine. It can be found in liquid form or a capsule. Actually, a tablet, I believe. Talk about Lugol's, specifically the history there, and the different components of iodine that make that up.
So Dr. Lugol formed Lugol solution in the 1800s. And what he found, you know, iodine's a really cool element. If you bring up iodine to anybody, their ears perk up. They don't, but they might not know anything about iodine. They don't, they kind of maybe have some idea that it's related to the thyroid. Maybe they don't, but it's very rare if iodine comes up out in the world with doctors or just lay people. People come interested. Their head snaps up a little bit. They start looking at you, or they start wanting to talk about it more. So Dr. Lugal found when he added iodine to a solution of potassium, that he could put it into solution, and he came up with Lugal's solution. So Lugal's solution, 5% Lugal solution, is a substance where one drop contains 6.25 milligrams of iodide and iodine. Those are two different forms of iodine. One is a reduced form iodide, one is an oxidized form iodine. If we all go back to high school chemistry class, that oxidized form means that in the outer shell of iodine, it's lacking an electron. It's looking for an electron. It wants to gather it from vitamin C or something else, out there. The reduced form, the outer shell has full complement of electrons. They're all paired appropriately, iodide. Now, my first 10 years of my practice, I was using iodide only, the reduced form. Why did I use that? I used it because there's a prescription item called SSKI. What is it? Saturated solution of potassium iodide. And I could write a prescription for patients to get it. That's really the only reason I used it, because I didn't know about iodine. So I didn't know that Lugal's was different than that Lugal's has both iodine and iodide in it, where a lot of iodine solutions just have iodide, the reduced form in it. So what Dr. Abraham taught me, the man taught me more than he'll ever know. But one of the two top things he taught me about iodine was that different tissues of the body primarily respond to different forms of iodine. So, for example, the thyroid primarily takes up iodide, the reduced form, whereas the breasts take up iodine, the oxidized form. The stomach takes up iodide, different tissues take up iodine. And so if you want a whole body effect for iodine, what would be the best form?
Both.
Both, iodine and iodide. Now, having said all that, the first 10 years of my practice, I told you I was trying iodine on and off. It wasn't working. The iodine I was trying was iodide, D-I-D-E. I was trying it for the thyroid gland. I just told you that the thyroid primarily takes up iodide. That's true. But it needs iodine to work inside the thyroid gland. I just didn't know any of this. You would think the thyroid should do fine with iodide, only it doesn't. It needs so to get the whole body effect for iodine, the best form, I can tell you after 25 years of using it, in medicine, there's not a lot of things you can say, I'm 100% about, but I'm 100% about that. That the best form of iodine for the human body is a combination of iodine and iodide in the exact same formulation of Lugal's. It's about almost a 50-50 split between the two.
Earlier, you talked about 5% Lugal's. I know there's also 2%, and I think over in the UK, there's 15%. That might be just calculated differently, and it's actually equivalent to one of ours. Can you explain the different percentages there?
So 5% iodine supplies one drop, 6.25 milligrams of a combination of iodine and iodine. 2%, you'll do the math with it. It's not it's a little under 50% Dequane, so it's 2.5 milligrams or so, something like that, of a combination of iodine and iodide. The problem I've seen is there's a lot of 2% iodines on the market that I don't know what it is. I don't see iodine levels go up with it. And I never tested it. I just tell people you need to get a Lugal solution or Lugal tablet, a Lugal solution at that time. And I just had a patient this week with the same phenomena, exact same thing we're talking about. I felt a nodule in her thyroid, put her on 50 milligrams of iodine, and I rechecked her thyroid nodule 6 months later, and I just called her today actually and said, we might need to get a fine needle aspiration of this. I said, it grew a little bit and it looks, the radiologist is reading this as suspicious, and needs a biopsy. I said, it's unusual that happens if you're taking 5% Lugol's iodine. She says, well, I'm not taking that. I'm taking 2%. I'm like, where'd you get it? On Amazon. And I said, how much you taking? She doubled the dose. If I said 8 drops, she doubled it. Hers to 16, which is pretty close to what I wanted, if it's 2% iodine. And I said, either you get a biopsy right now or switch to 5% and let's recheck up ultrasound in a couple of months. And she chose to do the latter. And I've done this enough where I've also seen when they get on the right iodine, then the nodules will start to shrink down in size.
Have you heard of this 15% over in the UK?
I have not.
Okay. And brand name. There are different companies with Lugol's. I believe J. Crow they claim to be the original, or they have a deep history. Is there a certain brand you recommend?
There's a lot of companies making iodine out there. And back in my day when I had the testing set up in my office, and I go to Dr. Abraham 4 to 6 times a year when I'm seeing patients full time. I got 2 kids. I got a wife. But I made the effort, and we when I get there on a Thursday, we would get in the lab and we'd work 12 to 14 hours a day doing bench work, testing things. And we would test various iodine supplements. What we found was unbelievable. It was the companies would say it's 6.25 milligrams of a combination of iodine and iodide, or 12.5, or whatever the hell they'd say. We tested, it wasn't there. So there was one company in particular I can talk to you about. J. Crow, I haven't tested, so I don't know. So I was at a lecture, and I was lecturing about iodine, and the guy handed me this bottle. And he said, this is 30% cheaper than this company that's putting on this conference that, has this other bottle of iodine. So I looked at it, I read the label, and it said each pill was 12.5 milligrams of combination of iodine and iodine, the same amount that tablet of Lugol's was in. So I held it up to the audience and I said, hey, I've just told this was 30% cheaper. I don't know much about it, but here it is. So I get it home, I open it up, and I look at the color of the pills, and they're close, but they're different. It's got this little different color. And I've been around iodine long enough, working in Dr. Abraham's lab long enough, testing things long enough to get an idea, maybe this isn't quite right. So I did a test in my office where I took out 50 milligrams of iodine pills out of that bottle, crushed them up, diluted them, and then tested their percentages. There was no iodine, INE, the oxidized form, and there was iodide, because iodine's a lot cheaper than iodine. So I called the guy who gave me that bottle, who owned that company, and I said, hey, there's no iodine in here. Yes, there is. Read the label. I'm like, I read the label and I did my testing. It's iodide. 12.5 milligrams of iodide per pill, not 6.25 like there should be. And he said, no. And I'm like, yes. And voices got raised. And I did another test with it where I did a mass spec analysis, and there was no iodine in that as well. So voices got raised, and I said, I want to know, it says manufactured in Detroit. He was from my area. And I carried a few of his supplements. And I said, tell me how you're doing the manufacturing, because I knew how to do it. I had worked with Dr. Abraham on this. And he's hemming and hawing, and he starts talking, and he doesn't know what he's talking about. But I called him on it. He said, okay, I don't manufacture it. Joe manufactures it in Wisconsin. Give me Joe's name and number. No, you can't talk to Joe. I said, well, you're calling Joe, and I write down how he's manufacturing and call me back. So he calls me back, and he goes, okay, fine, there's no iodine in there. We just used iodine. Why did you do that? Because it was cheaper. And I said, how'd you get the brownish color? That's what tipped me off, because the color was just off a little bit. And he goes, we used riboflavin, vitamin B2. We had a hard time working with iodine because it's unstable, which it is. It takes a little technique to get it into pill form. And I learned my lesson. I only try and use products where I trust the company. They will have independent testing, and I know what's in. Look, I'm not manufacturing. I'm not there in that factory pouring the things together and watching the pills being made. But I do know enough now to realize there's so much garbage on the marketplace, especially stuff from Amazon. There's labels that are made up that look like other labels. And I've talked to companies that I trust who tell me that there's counterfeit labels on sawdust products. They don't even know what it is. They do the testing and they can't even tell what it is. The labels look exactly like the real thing. And there's this cool thing about iodine is you could test. I can test and say, hey, something's wrong here. It's not, the levels aren't what they should be. I can do the same thing with vitamin D. I can do the same thing with thiamine. I can do the same thing with riboflavin. I'm just trying to think of my lab slip. I can do with a few other things where vitamin C is another one. So much garbage out there. It's not vitamin C. It's sawdust, or I don't know what the hell it is. But you tell me you're taking 3,000 milligrams. You're not. It's your serum levels. It's either not absorbable form or it's not in there. And these are good company names on these labels. I mean, these are popular names that are out there. And then when I switch them over to something that I know has 50,000 units of vitamin D in it, or I know it has 1,000 milligrams of vitamin C in it, and they start taking the recommended dosing and I check their levels again, they come right up. So the same things happen with iodine. It's important to work with an iodine literate healthcare practitioner who can help you with this and check your levels and make sure you're getting what you're paying for. If you're just buying stuff on Amazon because it's cheaper, beware. It ain't so good to do all the time.
Okay, bottom line for you and your family, what brand do you use? And does it matter if it's liquid or capsule?
We use Lugol solution, 5% Lugol solution. We use that a lot. We make our own iodine right now. And part of the reason we make our own iodine was what happened with that, what I just told you that story with. So I know, and I have we make some of our own supplements. And when I formulate a supplement with a manufacturer, because I'm not there in that plant mixing that stuff, but when I formulate a supplement, I always tell the manufacturer, if anyone tests these things, I don't want anyone coming back to me saying it's sawdust or something like that, or it's not in there. Iodine's not in there. So I want a 10% fudge factor more of anything, whether it's 100 milligrams of magnesium. I don't want it ever to come back 90. I want it to come back 110, or 100 minimum. So we make our own iodine tablets. It's called iTabs. I have tested Biotics products. They're Iodine HB. Those are good products. But Biotics is another one. There's a lot of false labels on Amazon. You just got to be careful. They get it from a good practitioner who's getting it from the company. Lugol tabs is another one that's a good product that's been tested. And that's what I use.
Okay. I said I wanted to come back to kids. Let's get there, but let's take it even further back. Somebody pregnant and dosing with iodine, somebody breastfeeding, and then let's move into younger kids and then teens.
The worst patient to treat is a pregnant woman, because if anything goes wrong, how do you know what you didn't cause that? And that's but women should have their young women should have their iodine levels checked and rectified before they become pregnant. That's the best way to do it. In the first trimester of birth is when everything forms, all the organs form, the neurologic system forms. You need iodine for that to occur. If there's not enough iodine, plus or minus not enough thyroid hormone in that time period, they're going to have glandular problems. Thyroid, ovaries, uterus, breast, prostate, pancreas. The same thing that we're seeing across our country right now. So it's best to do that before they're pregnant. And if women are in 25, 50 milligrams of iodine, which I like them to be going into pregnancy, I leave them at it through the pregnancy. We've had 3 kids in our 25-year history of using iodine. We've had 3 babies born when neonatal testing, because every neonate in the U.S. is tested for thyroid problems when they're born, who tested as severely hypothyroid at pregnancy. And they're put on thyroid hormone, and it's can be stressful and a big deal, and phone call and all this stuff. And generally the doctors at the hospital are going to blame the mom from taking iodine in pregnancy and say that's what caused this. So of those 3 kids, what happened with these 3 kids? First off, kids can get hypothyroid in pregnancy, and that's why they test every kid, whether they're taking iodine or not. But when you look at the thyroid levels from the 3 kids, what you can see is that for whatever reason, the thyroid gland was immature to develop in the baby and took a little bit of time. None of these kids were on thyroid hormone for a lifetime. These babies were put on thyroid hormone for a month or two until their thyroid gland finally caught up to where it should be. And then they were able to come off thyroid hormone. There was no harm in these kids. And that's 3 out of, I don't know. I mean, I don't even know how many. It's hundreds and hundreds and hundreds, if not, over 1,000. We have 7 practitioners in our office. So I like young women of childbearing age to have their iodine levels checked, get them iodine before they become pregnant. I have studies showing that over 50% of women of childbearing age are deficient in iodine, according to WHO criteria, which, let me tell you, WHO criteria ain't nothing to write about, because their criteria is way too low, but they're even low on their criteria, which is too low anyways. So I think that answers that. What was the other part of your question?
Well, it sounds like from what you just said there, if somebody's taking iodine before getting pregnant, which is preferable, while they're pregnant, they continue on that dose.
I continue the same dose while
Okay.
I'm pregnant. But look, I'm checking other things. I'm checking the thyroid levels. I'm checking, iron, B vitamin levels, part of a holistic treatment regimen.
Okay, and then I would assume that would continue while they're breastfeeding?
Absolutely. The only source of iodine for that baby is going to be in mom's breast milk. And if mom's like all the other moms in this country, they're going to be severely deficient in iodine. That baby's going to be deficient in iodine. Therefore, you're going to have, iodine deficiency leads to intellectual decline, leads to IQ decline, leads to neural behavioral disorders. There's a whole idea and studies that show iodine deficiency may be the cause of our ADHD epidemic that's just come out of nowhere the last 20, 30 years. And, it's just a big mess. Everything's a big mess.
Okay, so ideal situation, the woman gets her iodine topped up before getting pregnant, continues supplementing through pregnancy, through breastfeeding. Let's go to the child now who is weaning. How do you begin to supplement iodine, and at what age?
We have a new grandbaby, and she's 14 months old, and she gets iodine. So we have babies supplement with iodine where they dose them down for their size, and they'll, I don't know, it depends on their body weight, but it's like 6 milligrams for a week or so, something like that, or 2 weeks. We have different doses for, as the babies get bigger, and they use a liquid. The easiest thing is use a liquid iodine because they're drinking, and they can get in their water or their, juices or things like that.
Got it. So they'd be using the same 5% liquid, but it's just spreading that out maybe once every 2 weeks.
Or more, depending on their size.
And how quickly would that ramp up? I'm picturing somebody who's 8, 10, 14. Obviously, it probably has to do with body weight, but just in a general sense.
As soon as they get to 50 pounds, I'm using about a drop a day for them. And then, 100 pounds, maybe 2 drops a day, which is 12.5 milligrams. And so,
since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
Over the last 50 years, iodine levels have fallen over 50%. We've tested over 8,000 people for our iodine levels, just right below 98% are iodine deficient. The vast majority are severely iodine deficient. In our toxic world, with our exposure.